It is a misconception to think that we don't need to have bowel movement on a regular basis.
Welcome, everybody, to the Cleanbody for Life podcast. I am so excited today to introduce France Robert. She is a therapist of the digestive system, specializing in colon hydrotherapy, one of my favorite treatments. And I really wanted to bring her on because people have a lot of reservations about doing this treatment. And I have found so much success with using this treatment with my patients, especially those with skin conditions, gut issues, hormonal imbalance, honestly, everything that I have treated, it's related to the gut. And with colon hydrotherapy, we can get there in a way that sometimes supplements and diet, it just takes a long time to produce these same results. And so I love colon hydrotherapy. So welcome, France. Thank you so much for joining me today.
Well, thank you for having me on your podcast. I'm really honored. I met you many years ago, and I'm happy to join you this time.
Yes, and I would love to know a little bit about your background because I think you have a unique background coming from a conventional medical side and then
Exactly.
kind of making the jump into holistic medicine. So tell us about that journey.
I'm a little older than you, and years ago, I wanted to help other people. I was first an athlete, and unfortunately, I injured myself, so I had to change careers. And helping others was something that really resonated to me. So I went into the nursing, and I also worked in hospitals as an aide. And because they knew I was going to be a nurse, they gave me a lot of private patients and different things of burning, all kinds of different patients that had different challenges. But I was always limited. Don't do too much. Don't work so much. You're making us look bad. And it was more of a break. And you don't put brakes on me. I'm a worker. I love to just go out there and learn more. So my mother had been very sick with her digestive tract, and I could see that the doctors was addressing a lot of hernias and ulcers and different things that she had with her digestive tract by putting medication. But I was seeing my mom getting worse instead of better. The symptom, one would go away, but a new one would come. And one of our neighbors was an iridologist, and she told my mom, hey, let me look at your eyes and let me look at what you have. And naturally, when you come from the Western side, you look at the Eastern like being a little bit of quacks. So my mom addressed it like that. And the lady said, what do you have to lose? You're the one, bleeding. You're the one having issues. So how about I look at it? And within 2 weeks, the bleeding stopped by herbs, by changing nutrition, by starting cleansing. And I would bring my mother to a colon therapist that did not work with an FDA, in this case, because I was in Canada, CSA, a registered device, but I could see she was getting better and better. So I started studying iridology, and I was only 6 months from being a nurse license, and I completely let that go and went full force in iridology, massage therapy, nutrition, herbology, and naturally colon therapy. I was then in French, so my base, well, my first language is French. As you can see, there's an accent. And the doctors, like Dr. Cousnin in France, that was very well known, was a pediatrician that became a specialist of cleansing and nutrition for MS patient and all kinds of other challenges. So she left the pediatrician to help all ages. And I learned a lot from her. So from Western nursing to Eastern, I love to combine both. I love to understand both. I respect both. But the answer for prevention is on the Eastern side.
Absolutely. I love that journey. It's so similar to mine. I jumped from going to medical school, conventional medical school, to naturopathic medical school because I just saw the light as well too. And I think when you see it, you can't unsee it, right? And then it's very hard
Exactly.
to do conventional medicine after that. So
Very true.
that's so wonderful. Tell me about what colon hydrotherapy actually is. Can you tell me about the procedure and what someone might expect?
So the first thing is always go to someone that is certified, that is working with an FDA registered device. Those are meant to work with the proper pressure, the proper device that will protect you. So colon therapy is a gentle procedure. So when you go to a therapist, you need to have the information. So the client will inform you what's going to go on. You're going to take your clothes off. Yes, you're going to put something in your rectum. And that is often what the clients worry about it. It's like, is this going to hurt? It is lubricated. It is done gently where your body accepts the speculum or the rectal nozzle, depending on if you work with the open or the closed system. Both are good. It is often the therapist that makes the difference of you feeling comfortable with the time they take with you, with the education, and really saying, this must not hurt. If it hurts, it is because either you need more lubrication, or maybe you're going in the wrong angle, not the wrong hole, but the wrong angle. So that's where taking your time, making sure that things are going well, then very gently, once it's inserted, very gentle water will go in. Clients barely feel the water go in. It's like, are you sure you turned it on? And that water will slowly go in and sort of hydrate the stools that are already in the colon to allow the muscle to say, hey, we need to push this out. So slowly, the what we call the muscle peristalsis will now move not only the water, but also the stools that are ready to come out, that are been hydrated enough. And that procedure will happen many times during a 40 to 50 minutes session. So the client will, in the closed system, say, oops, I'm full. But there's also a safety mechanism where there's a needle of pressure that the therapist sees, oh, the water's going in. So I've worked with paraplegics. They don't feel what's happening inside. I cannot bloat them because I'm going gently. And I have in my device something that tells me the body is ready to release. And that's where you allow the release. And in the open system, the body can release at any time. So there's in both, there's safety, gentleness, and there's no irritation as long as it's done with low pressure, a well-educated therapist.
You've mentioned the closed versus the open system. Can you explain those a little bit in more detail so people know what those two different systems are?
Exactly. There's two different ways of seeing closed and open system. So closed system is a little bit like a sink. When you open your faucet, it is a closed system. The water is directly opened and not, there's no tank holding the water. So that's one process. It is also connected to a view tube. So with the closed system, you have a speculum that has a little hole where when you put it in the rectum, it allows the stools to go into the speculum, into a waste hose, to the view tube, so you can see what's happening. The client may see what's coming out of them, and then it goes to the sewer. The water goes in very gently, about a quarter to half a psi, and it goes in and out, but it is operated by the therapist to allow the empty and to allow the fillness. So fill and empty is controlled by the therapist. The client and the therapist communicate that. On the open system, it is a tank that holds the water and it's gravity that comes in. So the gravity is never higher than 1 psi. So again, respecting the colon not to bloat in both systems. But when the water comes in, it can eliminate. So instead of having a hollow tube to allow the stools to come out, it is like a pen, a little pencil, and there's little holes at the end to allow the water, but the rectum will open to allow the stools to come down. So it's like you're sitting on a toilet in a way, or a channel. It's like a reclining chair. It is very comfortable. I said earlier, people that are paraplegic or paralyzed, often they do better on the open system because the nervous system and the muscle system is not working as well. And sometimes they have drier stool, bigger stool, harder stool, that the speculum, it wouldn't go in. Now the rectum can open bigger and eliminate. So both systems are safe. Some people prefer one or prefer the other one, but what is best for you? So sometimes I'll tell a client, I think we should start with open or close because of what they have as symptoms or challenges.
If someone was deciding where to start and they don't have you to talk to, how could they make that decision, open versus closed?
Right. And that's the big question. Because in my office, when I was in Santa Monica, we had both open and closed. So we would listen, and depending on who referred them, they would say, well, my friend went for that system. I want to follow what she does or he does. I'll give you an example of why I choose that. So if I have someone that is very nervous, a person that is clinched a little bit, I will prefer starting on the closed system because I'm there with them. They're on a massage table. It's very comfortable. And I don't do the insertion, but I support the insertion. So that means I present the speculum to the rectum, and together the client will do it. And there's like a better coaching in a certain sense. Compared to the open system, I explain everything, but I leave the room for them to do the insertion. And sometimes they feel they don't understand, they feel stressed, the rectum doesn't want to open. So once they understand that the elimination and the also hydration, it's easier to bring them onto another system because of what's inside of them.
Got it. In my journey, I did both. And I found that the closed system, I just found that I got a deeper cleanse. I felt like on the open system, I wasn't able to release as much. I felt like because I was in control of it, I personally just couldn't find the way to release correctly. And when I was in a closed system, I just loved how the therapist was massaging me and coaching me through it. And I do feel like there's an emotional connection as well here. And sometimes the therapist was really great at just kind of talking through it and, oh, how are you doing? And is there any stressors that we need to let go of? And so I loved having the therapist there. So I often do recommend the closed system for patients, unless they're really afraid of that speculum. Then, as you said, the speculum on the open system is like a pen, right? It's a little smaller.
Exactly.
And it's a little bit maybe easier to swallow to say, okay, maybe I'll start there. And then if that's okay, then I'll move into the closed system.
I like what you're saying because the sales pitch is very important. People that have had the closed system where they felt the speculum was too big, in reality, it's not too big, but potentially the insertion of the speculum was done too fast or not lubricated, and it was uncomfortable. So now they really dislike, or they didn't like the personality of the therapist because they were potentially a little more matter of fact or harsh for them. On the open system, every time I had a client on the open system, they wanted me to stay in. They want the education. They want the body work, either reflexology of the foot. I don't call it reflexology because I'm not a reflexologist, but I'll work different ways of addressing the body to relax. And they really appreciate that on both systems. But it is the sales pitch of who you're going to see. And I hear it on both sides. I'll never go to the open. I'll never go to the close. And then when they come to my office, and if they're open system, I introduce them to the way I do the close. And all of a sudden they say, "Oh, I like it." And the same thing for people that really dislike the open system. I want to introduce them to a different way of being introduced to it. And I would say 99%, they say, "Now I get it. Both systems are amazing."
Yes. And I've had patients who have done both and they just love the open system. So I do think it's a personal, kind of a
Yes.
personal decision in terms of which one you like better. And everyone can be a little bit different there. So I think it's great because that's another question people ask me is like, which one do I do? They said they have both systems. One question I get is, well, don't we release our stool? So why would there be anything in our colon? Don't we release it every day when we poop? So tell us a little bit about that.
So we eat many a times a day, potentially 2 to 3 times, we hope. We hydrate properly. Hopefully, it's good. I call it good gas that you could put in, good nutrition to give good fuels to your cells. But we are supposed to eliminate. We will always have something in our digestive system because continuously eating and eliminating. Even the people that have the best hygiene, meaning having good bowel movements, they still come for colon hydrotherapy on a cleansing twice a year. They want to restart before the winter or before the summer. I've never had anybody have nothing coming out. If they have nothing coming out, there's a congestion inside. Because if it flows, something's going to come out. And I've heard some people say, "I went to my colon therapist and nothing was coming out, so that means I'm clean." It is completely the opposite. So we have at least 5 feet of colon, and I don't know anybody, including myself, who eliminate 5 feet of stool. And it's 2 inch in diameter. Then we have 23 feet at least of small intestine that is continuously moving to nourish ourselves. And then our cells are going to also shed because new cells are alive. We urinate, we are supposed to sweat, but we're supposed to have also good bowel movement. So it is a misconception to think that we don't need to have bowel movement on a regular basis. I've heard medical field, we say it is your rhythm for you to go to the bathroom every 3 days. In my case, I was in boarding school at a young age. I was not home and I never wanted to bother people. So being in with the nuns and a lot of people, I held going to the bathroom and I would maybe go to the bathroom once a week. And I developed migraines. And it is not until I discovered colon therapy. So I was on a lot of medication to numb my migraines, and they were neuralgic. So it was all the side of my head. To understand iridology, nutrition, colon therapy, I was intolerant to dairy. I'm not allergic. And so milk is not my friend. When I started cleansing and having colon therapy, I discovered a new person inside of me. And I'm 68 and I have not had a headache since my early 20s. So not only migraines, so the minute I started cleansing, I will not allow myself to constipate, but I did not understand it. When the doctor saw me and says, "Oh, you have migraine, it's because you had your period too young." I don't know what that has to do with anything, but the minute I started cleansing my body, having regular bowel movement, and also taking the milk, not the cheese, but the milk out of my dairy, I have not had a migraine. So that was my personal experience of understanding. I did not know I was constipated.
And I think
Now,
most of us don't, right? Most of us don't. And I have
exactly.
patients, yes, who are like, oh, I go to the bathroom 3 times a week and my doctor said that was normal. I've seen this before. I've actually heard someone say that a doctor said once a week was okay.
Mhm.
And we are putting food in our mouth every day. We also have to exit our waste. If we're not exiting our waste, where do you think that's going, right? So I like
Exactly.
to use the funnel concept. And if your
Mhm.
funnel is clogged, your funnel is going to start overflowing. Now, where are you going to see that overflow? Well, headaches and migraines are one place. Skin, you're going to see, of course, constipation, but then you're going to see joint pain and aches and things like that. And then from there, more and more chronic disease starts to develop, right? You get those initial alarm systems, I like to call them, like migraines are one of those. And I suffered from that as well, too, because I
Mhm.
was severely constipated also. So colon hydrotherapy has just been so amazing for me. And it was so
Exactly.
amazing that years ago, I actually got trained by you. That's how I know you.
Yes.
I then sent my staff members to go get trained by you.
Mhm.
And, and so I'm so glad we're having this conversation because this
Oh,
is
it's
such
amazing.
an important treatment. Now, I get so many people who don't want to do it for a number of reasons, and I'm going to list them off. We're going to start with number one, and then I would love to know what your thoughts are. So, number one, they say they go on Google and they find that it's dangerous. Tell me what you say to those people.
The danger, and I even spoke to an hematologist who said, "Oh, colon therapy is dangerous." And I said, "Okay." He didn't know what I did for a living, so it was a good thing I listened to him before. So he was really open to sharing what he did not like. And I completely changed his mind because he was stuck with the old ways of doing colonics, with the gravity fed at over 2 to 4 psi is really fast. That's what an enema can be. Well, they used the bucket in the hospitals where it was a bigger tube and it surges. So that is too strong. And what it does, it bloats the colon. So people that had a tendency to do the old technique of not pressured, it would bloat the colon. It would be painful and it would cause constipation instead of helping constipation because now you were loosening instead of toning. The techniques of today is low pressure, so you stimulate the muscle. It's like going to the gym. It's internal gym that you strengthen the muscle and allowing the bowel movement to release properly and the body now to regenerate easier. So that is one falsity in a way of painful and stressful. The other way is I've seen online also, you put a tube 54 inches into the colon. That was then, not anymore, where they thought by putting a water line high in the colon that it would reach the cecum, the beginning of the colon. And when they took x-rays while they did that, they could see it was just coiling. It was not going to the cecum. So it was not beneficial. And that is why it is important to have an educated person and a registered device because they have to abide by strict regulation every year. And the education, now the person can say, ask questions. And if the person cannot answer, it's okay. But do they have someone that they can refer to? I still have to this day plenty of students still calling me and saying, "What do you think?" And if I don't have the answer, I have books, I have other people. We're a collaboration of educated people to help everyone.
Thank you so much for that because I think that's really helpful to understand that today's devices and the way that we do colon hydrotherapy today is a little bit different from how we did in the past. And you
Exactly.
might be reading something online that is actually not talking about today's methods, right? So I'm glad you mentioned that. Now, the second thing I get is isn't that going to mess up my microbiome? And I talk a lot about the microbiome. So, of course, I would not recommend something to someone that's going to mess up your microbiome. So, tell me a little bit about that.
I have some articles that are very old from doctors that said, "Oh my gosh, you're going to deplete the probiotic. Let me look into it." And they've looked into it. We have to understand the microbiome balance exists if you have bowel movements. Constipated people do not replenish that microbiome. It becomes stagnant. And so the person that goes every other day to twice a week does not have the benefit of the self immune system that replenishes itself with the microbiome. So when you have a colonic, you have a bowel movement, maybe three bowel movements, maybe more, and that allows the mucus to replenish. So the microbiome, it is in the mucus layer and within the submucosa that it will be replenished. So as you cleanse, you have a stronger and better microbiome. Even if a person would have, and it's been tried, tested, where's the microbiome, if they have many colonics in a row, we're talking maybe 15 colonics within 3 weeks because they have a certain challenge that they want to address. They're doing a fast or whatever they choose to do. And when they tested their microbiome, it was stronger than when they started. So that answers pretty much how it can really benefit the microbiome.
And I have seen this time and time again.
Mm.
Colon hydrotherapy is an integral part of our clean gut protocols, is what we call them. And we have our patients do colon hydrotherapy along with that. And then we do our tests beforehand to look at the microbiome and our tests after. And the microbiome is typically nice and beautiful at the end. And we've gotten rid of opportunistic microbes and pathogens that are in the system. So thank you so much for mentioning that. Now,
Mhm.
what else? What else do people usually say to you when they say, nope, I don't want to do that. I've gone online and I've decided that's not for me.
Electrolyte is the other part. So the electrolytes are very important. Those are the minerals that we need for our skin, for our hair, for every part, the electricity in our heart, every part that is helping us maintain homeostasis or health needs good bacteria and a good microbiome. Electrolytes, where people have a tendency to forget, is again, hydration is good, overhydration is not. And again, in the education, we know we cannot give a session more than 50 to 60 minutes. Why? To keep that balance of hydration. So I've had people that came to me and they were having a gallbladder attack. I don't want to go to the hospital. And they would do certain herbs and they were on fasting. And I've given up to 3 sessions in a day to help that calcification loosen and release. And because we have to understand that the colon and the small intestine are attached with vessels, blood vessels, lymph vessels, and those communicate with the liver. So when the liver has an issue, it wants to dump into the gallbladder, and then that goes into the small intestine. And as you're cleansing it with herbs, if there's an attack, I'm not saying everybody that's having a gallbladder attack should go for colonic. It is a choice, and you have to be well informed of what to take. But you can take and cleanse the body. But your electrolytes, even though I said 3 sessions in a day, I gave electrolytes between, rest between, and at least 2 hours between a session and another session for an acute issue. It took 10 years. She didn't change this. It was a cousin of mine. She did not change her nutrition, and it took 10 years for her to have another gallbladder attack. But now I was not in Montreal anymore. So she chose whatever she chose to help herself.
Got it. So yeah, I think I've actually had a number of patients who have had gallbladder issues, and it's actually one of my favorite things to treat. And actually, when I have patients with skin conditions, I often find there's a liver gallbladder problem with some of those people having gallstones and they don't even know it, or sludgy bile. And they might
Mm-hmm.
know that because they have maybe a pain under their right rib or cramping. I used to have this when I had really severe eczema. I would get this cramp under my right rib, and I thought, oh, that's just normal for me. But it actually wasn't. It was my gallbladder saying, hey, there's a problem here. And I was constipated at that time. So, skin conditions, gallbladder issues, what other types of conditions have you seen that can be helped by colon hydrotherapy? And do you have some case studies that you can present to us to kind of
I
show?
I have many, naturally. In over 40 years, I've seen a lot of people, but one that stood out, especially to help people understand the pain or the fear of pain. So my cousin, whom I was very close to, had one of her kids, a son, who had a lot of issues with hyperness, ADHD a little bit, but nothing severe. And sadly, when he was young, at one point, the doctor wanted to take his tonsils out because he had tonsillitis, and he was about, I want to say, 3 years old. And he had a little, open pore close to his sacrum or the spine. And they said, let's just cut and make a stitch or two so that when he's older, if he becomes hairy, men often, it won't be an infection or it won't be a site of potential infection. So my cousin said, sure, that makes a lot of sense. So they did that, but not realizing that the child now would constipate himself because every time he would sit down, it would hurt. It went to the problem that he now had issues with, he was potty trained, and now he was not anymore. Now he was going to school. He was in kindergarten, first grade, and second grade and all that, peeing in his pants, poop in his pants, and a lot of kids did not want to play with him. So the doctor eventually said, oh, I know where the problem is. His sphincters are not opening properly in his urethra and ureters. So we're going to put a bag for his bladder to be able to empty properly. So now he was 8 years old, had a bag to urinate, and was still having other issues, and eventually was also constipated, but they never understood that potentially that was the problem. So forward, he's almost 11 years old, and my cousin and I were talking, and she says, yeah, now they want to take his bowels out. He's going to have a colostomy. And I said, time out, please, time out. You know what I do for a living, and I've been doing it for a long time. I'm not sure I can help your son. I cannot guarantee because I don't know. But give me a month. I'm going to change a little bit of his nutrition. He's going to stay with me during, it was Easter holiday, so he was not in school. I explained to him a couple of things. Yes, he's young. And we were working also with the doctor. The doctor knew what we were doing, colonic. So we had the prescription. We had everything done properly. The mother was there. And we gave him colonics, not every day, but he had colonics twice a week, closed system. And a month later, now he's going for his pre-op. And the doctor says, what did you do to him? And she says, what are you talking about? And that was the pre-op doctor. It was not the doctor that gave us the gastroenterologist. His colon is fine. Not only that, his sphincters of his bladder are fine. We're not going to operate. We're going to take the bag out. He is now 56 years old, never had a bag, and his bladder, kidneys never had an issue. He had different issues because he went toward drugs, but that's a different problem altogether. So for me, colon therapy was so powerful in the healing of my cousin's son. And to this day, he talks to everybody about it because having a colostomy is an end all. That organ does not grow. You cannot have a transplant of a colon. So having colonics and a nutrition balance, that's where the collaboration needs to be with the medical field. I totally honor the medical field for if I have a car accident and my arm is dangling, please do not bring me to a colon therapist. But for bringing my immune system after the operation of whatever I needed, they are not specialized in it. And that's where we collaborate and strengthen our population.
so much of our immune system is in our gut. And if you are dealing with any chronic condition, cleaning up the gut is where we need to start. And that starts by what you're putting in your mouth, as you mentioned, nutrition, and what's coming out. And if
Right.
what's coming out is, first of all, not every day, and second of all, not looking like a Bristol chart number 4, which is a nice sausage-like brown poop that sinks down to the bottom, then you might need something like colon hydrotherapy and to work with a practitioner who is going to help and guide you, right? Because I think there's
Exactly.
more than just colon hydrotherapy itself. There's what you're eating. And then there are some things that can be done to really help the cleansing process, the healing of the gut lining, and if there are pathogens and things like that, you need to address those things too. But for me, colon hydrotherapy has been integral in this process.
It
And
has to me too.
wow, that is an amazing story.
Mhm.
Now, do you normally do pediatric colon hydrotherapy, or was this kind of a special thing for your cousin?
It was a special thing for my cousin. I did have doctors that referred me kids that were younger, but unfortunately, they were also very challenged with cancer, with different things that it worked very well. But no, it is meant mainly for older. Kids are so easy to work with just with nutrition. We have to remember that colon therapy is the rectum. And the rectum is very close to their intimate part. And you never want a child to feel abused in any way, shape, or matter. So I do not suggest it for kids. The FDA also says 18 years or older, or if you have a doctor with a prescription. But even with a prescription, how comfortable are you as a therapist? It is okay to refuse a client if we don't feel well equipped. So the parents, the therapist, the doctor for the best benefit of the child. But again, and I've had a lot of clients, especially in Montreal, that would say, I want my child to feel better. It's like, okay, I'm going to teach you how to feed them, how to make them comfortable, because it's trust. Letting go is trusting. And when, like I said, when I was in boarding school, I did not trust that it was okay for other people to wait for me. So I would hold it and hold it. Or I wanted to go play because I was an athlete. So playing dodgeball was a lot more important than sitting in the toilet. And kids often have that part, or they go into public restrooms of the school that's dirty or whatever they are, so they don't. So it's allowing them to verbalize why they're not going.
I agree with that. I think, and kids are so vital, right? They're a lot more vital than we are after living decades and decades of life. That often, when you just give them the right things, and often that is very simple things, like I call them the pillars: good
Mhm.
food, sunlight,
Yes,
moving their body, stress relief. And yes, I think that kids do have that problem sometimes. They're afraid to go poop in front of other people or in a public place. So understanding and recognizing that. And when you fix that, things start to change very quickly with kids, I would say. So
absolutely.
I would agree with you. Someone like, older, 40, 50, 60, maybe we've lived a little bit more life. And
Mhm.
colon hydrotherapy can speed up this process. Right.
Exactly.
So I love that. And yeah, I was just wondering because I've never met anybody who's done pediatric colon hydrotherapy. And in general, it's not something I usually recommend just because I know that those kids are vital and can typically, get on their feet with just those simple things.
Absolutely. Absolutely.
All right. Well, this is so informative. Thank you so much for joining us today to talk about this. What would be a final message you would like to give to our listeners, after 40 years in practice and now training all of these colon hydrotherapists and, probably seeing thousands of clients and helping them with colon hydrotherapy? What are some final messages that you would like to tell our listeners?
I often tell clients, simplify your life. but also understand that healing is through nutrition. What are you feeding? Your taste buds or your cells? And today's world, we forget that Mother Nature gives us everything. In a box, it's not everything. It's not a good fuel. And listen to your body. When you have a headache, when you are hormonal, when you can't sleep properly, when your joints are hurting, it's your body saying, please help. Let's do something different. And through nutrition, it is amazing how you can heal yourself. And, Hippocrates said it eons ago, and his words are still as strong today as it was then. So go back to basics: nutrition, elimination, happiness. The stress of a television or computer games that all the kids are doing is elevating adrenals with no action, and that stiffens your body. So go out and play. Yes, play your computer, but go out and play. Now everybody works from home. They don't move anymore. So go out and walk. So walking, hydrating, happiness, and great nutrition already will allow you to eliminate better urination, sweating, and bowel movements. Colon therapy is a great asset to have, but it's not the must. The must is nutrition, hydration, and happiness.
I love that. And that is actually our Cleanbody method. So number one is get a good evaluation, which number one is kind of looking at your poop, right? Are you pooping every day? Looking at what it looks like. So just understanding, oh, okay. And then realizing that, okay, there's something wrong. Then number two in our method is the pillars. And you said all of them: clean food, clean fitness, clean environment, clean routine, clean mind is what we call it at Cleanbody. Exactly. And that covers everything you said. And then only then, if you still have symptoms after that, do we then think about support. And we actually noticed that when you just do those pillars, most people get better. Like 75% of the people who work with us get better, even just doing that. But then if more support's needed, that's where we love things like the colon hydrotherapy. And you also did mention, which I do actually about once a quarter, is a colon hydrotherapy treatment, just to kind of clean things up. And I've been doing that, since I healed my skin over a decade ago, and I've just continued to do that. I love that message. So thank you so much for that. Now, if somebody wants to do colon hydrotherapy, where do they get started?
They need to look at what's around them, and often they don't know. So I'm part of an association called IACT, International Association of Colon Hydrotherapy. There's a referral list. If you can't find, you can also look on my website and reach me. And my website is wellnessbyfrancrobert.com. And you can ask me a question, or you can call me or email me, and I'll help you find someone great for you.
Oh, that's so great. France is such an amazing resource. So I know the staff members that have been trained by France still reach out to her and ask her questions. And she's so great. You are so wonderful. You respond so quickly, and you're just such a wealth of knowledge. And mainly right now, you are training people on how to do colon hydrotherapy, right? So if someone is watching this or listening to this and you're like, oh my gosh, I want to do this, or I want to bring this to my wellness center, or I want to bring this into my practice, you can reach out to France. So France, can you just say your website again? And then if people can email you or call you, or how can they reach you?
Exactly. So my website is wellnessbyfrancrobert.com, and my email address is my name, France Robert, France like the country, Robert like a man's first name, at ieihealth.com. The IEI is the name of my school, Internal Environment Institute. So I'm getting up there in age, and that's me, because like you, a lot of people say, oh my gosh, you look amazing, you look so healthy. And a lot of people are looking at me and it's like, you have so much energy. I'm 68 and I would like to retire from traveling as much in my early 70s. but it's because I love playing with my grandkids. So yes, I want to have other instructors where I could support and do things like you are doing right now, online, reaching many people.
Yes. Thank you so much, Franz, for having this conversation with me. And I really appreciate this because I think this is going to be such a resource for my patients and followers. So thank you again for joining me.
Thank you so much for having me, and I can't wait to hear from everybody.